Hello everyone. In this video, we'll be studying about autoimmunity. Okay? Autoimmunity is a condition where the structural and functional damage is produced by the action of immunological components, cells, or the antibody against a normal component of the body. Okay, autoimmunity or autoimmune disorder means here the immunological response will happen to the self antigen. Okay, so self antigen means our own like body is having antigens which are not exposed. Okay, so that against that particular self antigens antibodies will be produced. Okay, autoimmune disease should exhibit the following features. Means to call it as autoimmune disorder, it should fulfill all these criteria. So first one is it should elevate the immunoglobulins. So immunoglobulins we know, right? IgG, IgM, IgD, IgE, IgE. So it should elevate that particular antigen antibody reaction or the production. Okay, should elevate the immunoglobulins, and it should be demonstrable autoantibodies. Okay, so that particular antibody which produces against the self antigen should be demonstrable in the serum of the patient. Okay, and this immunoglobulins which produced against the antigens, self antigens, should be deposited in a particular site. Okay, means for example in case of rheumatoid arthritis it will deposit in the joints, right? So same thing, it should be or we'll be able to see the deposition in the site. Okay, and accumulation of lymphocytes and plasma cell at the lesion site, so where it is get affected, so there should be some immunological reaction, right? So accumulation of the lymphocytes and plasma cells should happen at the lesion site. And genetic predisposing, sometimes it is hereditary, right? So genetic predisposing also um, feature will be there. Okay, then if you see the literature, this autoimmunity or autoimmune disorder is most most common, or it is the rate is higher in the female when compared to male. Okay, and chronicity, and usually it is non reversible. Chronicity means it will be there with us for a longer duration. Okay, more than 6 months or years together it will be present in the body, and it is non reversible or irreversible. Okay, once the body start recognizing the self antigen and start producing antibody, will be not able to reverse the reaction. Okay, so these are the following conditions it should like to call it as an autoimmune disease. Okay, so we'll see the mechanism. So cells or the tissue undergo antigenic alteration to form a new antigen or self antigen and elicit a immune response. Okay, so these cells will undergo antigenic alterations. Okay, maybe some factors like physical, chemical, or biological factors will influence on the cell or the tissue. So it will alter its morphology or the characteristics, and it like that we call it as self antigen or neonatal antigen, or sorry, neo antigen. So it will lead to the immune response. Okay, so neo antigens may arises due to physical, chemical, or the biological influence, or due to mutation. Okay, so how this tissue or the cells will undergo antigenic alteration may be physical, chemical, or biological characteristics. Okay, and sometimes it due to the mutation also. Okay, so we'll see physical. If you see the radiation, exposure to the light, or exposure to extreme cold. Okay, so this damages the cell, or it will causes some alteration in the cell. It may lead to the uh, elicit immune response. Coming to the chemical, so some chemicals cause like allergens, chemical allergens what we call, so it will induce this immune response. For example, contact dermatitis, that is type 4 hypersensitivity reaction, and drug induced anemia. Sometimes if you take some drugs, okay, so induced, it will induces the anemia, okay, and leukopenia and thrombocytopenia. So when you are taking some drugs, or if you are in the therapy, right, so it may causes some clinical conditions, or it may causes some adverse reaction and may elicit the immune response. Coming to the biological factor, you have viral infections, right? Infectious mononucleus is one example. So where this viral infection will transform your like antigenic alteration. It causes the antigenic alteration and it will elicit the immune response. Okay, so basically the cells or the tissue undergoes alteration. Okay, alteration means some morphological or physiological change will be there in the self antigen or the self our own cells. Okay, so that time what will happen, the body will recognize it as an antigen or the foreign, okay, and it start producing the antibody. Okay, this particular reaction we call it as autoimmune disorder or autoimmune disease. Okay, so hope you understood the mechanism, right? So how it will happen? Because of the physical, chemical or biological influence. Okay, coming to the different disease or the different clinical condition, we'll see one by one. So immunological damage also occurs due to cross-reacting antigens or similarity with the self-antigen. Okay, what do you mean by this? Cross-reacting antigen we know, right? So if you take the rabies vaccine with the neural sheep brain vaccine, the vaccine which is prepared with the help of neural sheep brain, so it can causes neural damage in the humans due to cross reaction between the human and sheep brain antigen. Okay, so one more example we will see, the Streptococcus pyogenes, group A Streptococcus. We have studied in bacteriology, right? So Streptococcus pyogenes infection can damage heart muscle due to cross-reacting heart muscle antigen and streptococcal M protein. So what will happen? Streptococcus pyogenes infection, bacterial infection will come, and you know antibody will produce, right? So this streptococcal antigen which has similar characteristics or similarity, cross reacting feature with the heart muscle. So that time what will happen, the antibody which produced against the streptococcus will also act on the heart muscles, and it start producing the antibody. So it will cross react with that particular muscle and it may lead to autoimmune disorder. Okay, so these are the two most common examples. Okay, so certain self antigens are closed system, not accessible to immune apparatus, known as sequestered antigen. Okay, so some self antigens are in a closed system, means it will be there inside the body and it is not coming in contact with your antibodies. Okay, so one example is lens antigen of eye. Okay, so the eye lens has particular antigen which is not exposed, okay, until and unless there is some injury or any circumstances. Okay, so it is not immunological tolerance is not established in the fetal life, means if by accident if that particular lens antigen comes in contact with the immunological cells, so it consider it as an foreign and start producing the antibody. So how it will happen, maybe during any surgery or any injury or any some accidental thing. So if the injury in the lens happens, so it will leak that content. Okay, so what will happen, so and the body will recognize it as an antigen. Initially it was in the hidden form, right? So that's why our body don't know that is self thing or our own body part. Okay, so it will start producing the antigen and it causes damage to other eye also. Other opposite eye lens is damaged. Okay, so classification, if you come, so you have several disorders like hemocytolytic, localized, organ specific, systemic, non-organ specific, and transitory diseases. We'll see one by one. So hemocytolytic autoimmune disease. Hemo means blood. Cytolytic means a death of the cell or the harm to the cell, right? So autoimmune hemolytic anemia. Okay, so you have two type of reaction here, that is cold and warm. So coming to the cold reaction, so cold autoimmune antibody are IgM antibodies which agglutinate with the erythrocyte at 4 degree. 4 degree means that is cold temperature, right? So it will causes seen in the primary atypical pneumonia, trypanosomiasis and black water fever in malaria. Okay, so basically hemocytolytic means it will causes damage to the erythrocytes. Okay, coming to warm, that we can see in the patient who take the drugs like sulfonamides or antibiotics. Okay, so it can be demonstrable with the help of comb test. Basically, if you want to see any autoimmune disorder which is present or absent in a particular patient sample, so you have to do any antigen antibody reaction. So hemocytolytic means the damage to the erythrocytes. Okay, so coming to thrombocytopenia. Thrombocytopenia, seen in the idiopathic thrombocytopenic purpura. So disease called as thrombocytopenic purpura. In this case, we can see autoimmune thrombocytopenia. So autoimmune leukopenia, which is an organ specific. So if you take the organ specific reaction, you have different reaction like Hashimoto's disease, myasthenia gravis, Addison's disease, autoimmune arthritis. So many things are there if you take the localized autoimmune disease. Localized is for a specific region or specific site, organ specific we say. Okay, and autoimmune diseases of eye and nervous system. Okay, so here you can see in Hashimoto's diseases, so you have that inflamed hypofunctioning of thyroid, we call it as goiter, right? So hope you know this. And here also you can see the enlargement or the like not very usual condition, right? So the unusual thing of the eyeballs we can see. Okay, and in myasthenia gravis you can see the very what do you say, like very unbelievable situation, right? Coming to systemic autoimmune diseases which is not organ specific, so systemic lupus erythematosus. Okay, so it is SLE, we call it as SLE. It is a multi-system disease. It is not specific or it is not confined to particular organ, so it can causes damage to the different various sites. Okay, so autoimmune antibody against the cell nuclei, so intracytoplasmic cell constituents and antigens, right? So what will happen here, the neutrophil, if you see, observe under the microscope with the fluorescence staining, so you can see the neutrophil will be large and like it is bigger than that of the normal size of the neutrophil, and you can see that is homogeneous body filling the cytoplasm. Okay, so what will happen in this SLE, that is systemic lupus erythematosus, it is immunologically damaged nucleus of leukocyte. So leukocyte nucleus will be damaged here. Okay, so to detect this SLE, you can do ANA test or immunofluorescence assay to detect the anti-nuclear antibody. Okay, so this is the picture of SLE. And the most common nowadays is rheumatoid arthritis. Okay, you know, right? So you search for rheumatic uh, or the rheumatic factor or rheumatoid factor, you will go. So it is predominant IgM, and very rare condition you can see IgG and IgA in the patient serum. Okay, so it can be detected by latex agglutination or agglutination test. Okay, and Rose-Waller test. Okay, particular for rheumatoid arthritis. So what will happen here? So the joints pain will be there, polyarthritis will say. Okay, so muscle wasting will be there, and you have that swelling of the joints. Okay, so you can see here picture, right? So swelling of the joints, we call it as rheumatoid arthritis. Okay, so polyarterial nodosa, it is a necrotizing angiitis of the medium sized arteries leading to fatal coronary thrombosis, cerebral hemorrhage, and gastrointestinal bleeding. So what will happen here? The arteries which supplies the blood, right? So here the arteries will be like bleeding will be there, internal bleeding will be there. So it may causes the cerebral hemorrhage. Jones syndrome, okay. In Sjogren's syndrome, so you can see that conjunctivitis, dryness of the eye, dryness of the mouth without the salivary gland enlargement. Okay, so you can see here. Okay, coming to the transitory autoimmune process includes the anemia, thrombocytopenia, or nephritis following infection or drug therapy. So what will happen basically? So you'll take the therapy for disease, right? So the symptom or any diseases, you will take the therapy. So ultimately it will change the morphological or the anatomical damage to the cell or the tissue. So it will lead the body to recognize it as an non-self and produces the antibody. Okay, so this is the picture of Sjogren's syndrome. So you can see here the dry eyes. Okay, so liquid should be there, right? So in this syndrome, what will happen? You will see dry mouth and dry eyes. So that is the basic feature of the Sjogren's syndrome. Okay, so hope you understood the concept of autoimmune disorder. So autoimmune disorder is nothing but the body when exposed to some physical, chemical, or biological factor, so the cells or the tissue will alter its physiological or anatomical structure, so that the immunological reaction will elicit. Okay, and it will produces the reaction, that we call it as autoimmune disorder. Okay, if you have any queries or any doubts, you can comment in the comment box, so I'll be answering to your question. Okay, thank you.